The University of Medicine and Dentistry of New Jersey celebrates a rich legacy of service to New Jersey and the world.
I'm Dr. Robert Johnson, Dean of New Jersey Medical School. I've been a member of the UMDNJ community since 1968. We started off as a very small school, just training physicians. We've grown up into this great research institution. And over those years, we made significant contributions to all sorts of health issues. As I think about achievements of UMDNJ over the last 40 years, I think about people who made these achievements and people I've had contact with. James Zaleski and pediatric HIV and his key involvement in understanding what the HIV was in children. I think of Stan Bergen and his development of UMDNJ. He's the person who had the vision for this great university. I think of people like Frank Burley, who was one of my chief mentors. He was chair of pediatrics. He was the person who aided me to make many of the decisions I've made in pediatrics. But I think also of many, many hundreds and thousands of people who work for this institution and have made significant contributions to the improvement of healthcare in the city of Newark. The people who have worked here and provided either trauma care or primary care or complicated surgical procedures that have been done in this institution, all of those individuals. So, over 40 years you come in contact with many, many people. The other thing that's been important for our students has been the people of the city of Newark, because the people of the city of Newark have allowed us to be here for 40 plus years, and they have participated with us in the training of not only medical students and physicians at New Jersey Medical School, but at the dental school, the nursing school, School of Health-Related Professions. And so they have been our partners in developing these very important resources for healthcare in this state and indeed in this city. And without them and without their active involvement, would not have been able to do what we've been able to do. I think ultimately the integration of Rutgers will be a very good thing. The integration of UMDNJ with Rutgers University will broaden our ability to take full advantage of their greater appreciation for the social sciences, and will allow us to put healthcare in the context of the whole social and physical environment. And that's going to produce better trained healthcare providers. It will also enhance our research. And for example, many of the great discoveries we have, in order to be used, we'll have to take appreciation for how they're going to be used in cities or in countries or wherever. And that interplay of records will help us in that regard. The other thing is it will ultimately give us more resources, and I actually do think that it will improve research in the state of New Jersey. So I think it will be a good thing.
We celebrate the many accomplishments of UMDNJ and eagerly look forward to further achievements that lie ahead.